For every patient, it's when he see a radiological picture with a tumor, apple-sized tumor in the middle of his brain, it's very difficult to believe for him that it is his picture and it's his tumor, and all he has is just noise in his ear or some blaring in his right eye. And of course, first question is the surgery really necessary? The second question is it possible to survive the surgery? And the third question is, how will be I after the surgery? I'm Professor Sергejem Spektor. I'm in charge of neurosurgery in Assouta Hospital, Tel Aviv. And additionally to general neurosurgery, I have additional subspecialties: skull-based neurosurgery, neurovascular surgery, and brain tumor surgery. Nowadays, the paramount aim of neurosurgery is not only to overcome the disease, but to preserve the patient's functions. So the modern standard of neurosurgery is to keep the patient functioning or working, and to provide the possibility for the patient to come back to normal life and to his work after some period of recovery, after difficult surgeries. We have the possibility to preserve the patient functioning with a good quality of life. How is it achieved? We don't have to chase after the entire tumor nowadays, if it is not possible. Of course, if it is possible, we prefer to remove all the tumor, but if it involves vital structures, penetrate the brainstem, involves very important nerves or vessels, and the damage to the structure will cause the damage of the patient and ruin his life, we have the second line of treatment, which is called radiosurgery. And now we know very well the possibilities and limitations of radiosurgery. Why do we call it radiosurgery? It has nothing open with surgery. We don't have to open the head, but the procedure is done with the beam of radiation beam, and it is so strong and so precise. It's similar to the surgical scalpel. So what we cannot finish safely during the surgical procedure, we may accomplish later on with focused radiotherapy or radiosurgery. And for example, for me, as I use both modalities, it is very, very, very convenient and also wise to know what can I do while regular surgery and what should I accomplish later on with the radiosurgery. Nowadays, we have excellent superior microscopes, but traditional neurosurgery demanded opening of the head. So we have to make an incision and to open the skull and to get to the brain and to remove the tumor of the brain. If we are talking about skull-based tumors, so we have to elevate the brain and to go in between skull base and the brain. We have very special, sophisticated skull-based approaches because we don't want to go through the brain and we don't go through the eyes or ears. We have special corridors, and it's very, very sophisticated approaches. You have mastered them in special anatomical laboratories. But additional to traditional surgical approaches, there is a relatively new trend, endoscopic skull-based surgery, because to the same area we can get through the nose. And we introduce endoscope. Endoscope is an optical instrument, very narrow. We used 4mm endoscopes, which actually replaces the microscope. And with the endoscope, we can go through the nose and we can expand the approach inside, and we can remove the tumors located in the cerebral base or in the cranial base. I have been working in Assouta for several years, and initially, and I continue to be very impressed, that the hospital is very effective. It is surgically oriented hospital with all necessary supportive services, with excellent intensive care unit, and it is staffed with the modern equipment. The hospital works very smoothly, and I think that both doctors and medical staff and patients feel comfortable here.